This concerns about transmitting infections agents such as hepatitis virus and human immunodeficiency virus have caused the healthcare community to become more aware of the need to disinfect and sterilize instruments, materials, and other equipment to protect providers and patients. So disinfection is essentially, it's a less lethal process than sterilization. The disinfection process does start in the main operating room at the back table, where they're basically clearing all the instrumentation of any grossly soiled bioburden, which is any living matter or clumps of like tissue or a lot of blood or anything like that that is on the instrumentation. Disinfection is achieved by either chemical or heat means. The following are some of the criteria for effective disinfection, which are the degree of microbial kill or deactivation required, the composition and texture of the item being treated, and the technical requirement and ease of use of the available agents. The levels of disinfection is it's classified as high, intermediate, or low level, and this classification is given by the EPA, which is the Environmental Protection Agency. That is a very important agency. If it's talking about what classifies these things, that is one name that you should remember. So blank is a less lethal sterilization, which kills disease causing microorganisms. Perfect. Disinfection is achieved by perfect, and the blank classifies disinfectants. EPA, beautiful. This is just a little chart that kind of like a cross chart to tell you based on the level of disinfection what it kills. So it can kill bacterial spores, tuberculosis, little germs, non-lipid viruses, lipid viruses, and a negative vegetative bacteria.
So I was talking about cavi wipes with the contact time in the 2 minutes to 3 minutes. Basically, if that stay time of 3 minutes is going to kill all those spores, compared to you leaving it on 2 minutes where it might only kill half of them. So like I said, if you read that cavi wipe bottle, it'll tell you which of those spores it kills based off the contact time. Maybe. Because you cannot completely kill bacterial spores with a high level disinfectant. The only way to completely kill bacterial spores is sterilization.
And then there's some things that you still can't.
So it's kind of like saying you use the hand wash stuff with like hand sanitizer. It can't tell you it kills 100% because it can't. It can only kill up to that 99%.
So disinfection, some factors influencing germicidal procedures are the nature of the material, organic, bioburden. The higher the level of microbial contamination, the longer the required exposure to the disinfectant is needed. So the more nastiness you have on there, more bioburden, the longer and more intense you need for the sterilization and decontamination process. Organic debris present, such as blood, saliva, other organic materials, tissues, may contribute to the failure of the germicidal process, and the type and concentration of the germicide. The higher the concentration of the germicide, the more effective and the less contact time.
So usually I like to tell this to people who don't know sterilization, because I like to relate it to something you do know. I want you to think about washing dishes, right? Say you have food on your dishes in the dishwasher. What is the probability that all that food is going to be removed from the dish when the dishwasher load is done? Slim, right? Now, if you rinse off that plate and make sure everything is off of there before you put it in the dishwasher, what are the chances that it's going to be clean by the end of the cycle? Going to be higher, right? Same kind of concept. So if you're leaving debris and blood on these instruments and you're not trying to pre-treat them before they go into the disinfector, then you're going to have a higher probability that it's not going to get all removed. You're going to have to do the whole process again. So that's why it's saying the higher level contamination is going to have a longer exposure to that chemical.
General categories of liquid chemical agents. The four most commonly used are glutaraldehyde, chlorine dioxide-based solutions, iodophores, and phenolics. Glutaraldehyde solutions are, there are several available formulations differing in pH, concentration, and exposure time. They're classified as high-level disinfection by the EPA. Inhibit the growth of harmful organisms or sterilants. Direct contact with skin may cause tissue damage, so it should be avoided. So you should wear your proper PPE, gloves, gowns, masks, all the eye protection, so to prevent any injury. And 2 to 3.2% are FDA registered. Chlorine dioxide solutions, they are a high-level disinfection of semi-critical items. It has a rapid action of 3 minutes for disinfection or 6 hours for sterilization. So that is saying that if you use it for 3 minutes, it will qualify as a disinfectant. However, if you extend that time to 6 hours, it can qualify as a sterilization, and you can render that item sterile. Must be discarded daily and has only a 24-hour use life as a sterilant.
So just so you don't get confused on the times, because you see 2 different times here, right? It's saying when you are using it, it can have up to 6 hours, right? Now, say you have this and you have this product, you can only hold on to that product for 24 hours. If it's past that, you can't use it at all as a sterilant. Does that make sense to y'all?
Iodophores are classified as intermediate level disinfectants or can be used as antiseptics if the product label claims tuberculocidal, lethal to the tuberculosis activity. They should not be used on white or pastel vinyls that are subject to staining from repeated exposure to iodine. The biocidal activity is accomplished within 10 to 25 minutes of exposure, and at high temperatures, iodophores can become unstable. They may not be used as sterilants. Iodophore antiseptics. Iodophore removes the microbial population from the skin, but also residual antimicrobial effect remains on the scrubbed areas. Can be used as antiseptics and a disinfectant. So this is one of the chemicals that we use in the brushes when we are scrubbing into a case. That kind of brownish orangey scrubbing. Phenolics are classified as an intermediate level disinfectant. When diluted properly, they are used for surface disinfection, useful on metal, glass, rubber, and plastics, and are less toxic and corrosive than glutaraldehyde solutions. Are there any questions thus far? Okay, let me know if I'm going too fast. I want to get you guys out of here. Another chart just to, these are the EPA registered surface disinfections for density. Semi-critical requiring chemical disinfection. So items requiring chemical disinfection are things such as 3-way syringe types, tips, high volume evacuation, saliva ejector tips, and radiographic positioning devices. We need, breathing tubes are not autoclavable. You must thoroughly wipe the item with absorbent material saturated with the EPA registered disinfectant. This requires high level disinfection and non-critical. Dental delivery system, these are things like the chair, unit, light, portable dental units, surgical table and chair, and x-ray apparatus. This should be done daily, the disinfection of these items. Paper or plastic headrest and bracket tray covers should be changed after every patient, just like a glove. Flush HVE, saliva ejector tubing, and cuspidor weekly with a central evacuation system cleaner, and require at least an intermediate level disinfection.
So there's a couple of test questions on this slide. Again, this is the slide I was talking about where it lists the examples, where they talk about the evacuation. So 3-way syringe tips are going to be semi-critical. Your non-critical, that's just wiping down. It should be done daily. And then, of course, that flushing I talked about is going to be weekly.
Sterilization, it is the highest level of contamination control because it results in the total destruction of all forms of microbial life. Healthcare facilities must have a central sterilization room. Some commands require that the disinfection, cleaning, lubrication, and sterilization of dental handpieces take place in the CSR instead of the medical treatment rooms or dental rooms. So sterilization is the end-all be-all of the sterilization process. That is what renders any material or instrument completely sterile, cleans off and kills off all of those spores and living organisms. At Portsmouth, we have the SPD, sterile processing department, and that is a separate entity of the main OR so that we don't have that cross-contamination of anything like or in decon and it's not getting in the patient room. That also speaks to why some facilities do have, like the dental, they can disinfect those things in a different room, just because, you know, you don't want to be disinfecting in the room where the patient is and all of those microbials and that nasty stuff is flying around in the room and potentially.
Keep in mind there's two differences for the hand pieces, right? So for the hand pieces to test them out, this is before they're used, you'll be using that in the treatment room and hooking it up for that, I think it's a minute. I believe it's a minute, but you're testing out those hand pieces to make sure they work. Now, the reason why you're not disinfecting those hand pieces in the room is the main thing that I talked about. What is our main concern in dental for infection control? What is the biggest mode of transmission? Aerosols, right? So the hand piece, it sprays out water and air, right? So if you're trying to disinfect all that hand piece in the room, it's basically spraying all those contaminants around in the room and make it more susceptible for the patient to get that or to be picked up on something else.
Sterilization process normally takes place in the CSR. Centralized instrument decontamination and sterilization are usually safer and more cost effective than the instrument. Do not rinse, scrub, or unnecessarily handle contaminated instruments or materials in the MTR or the DTR or other patient treatment areas. Only the CO or infection control officer can make written changes, exceptions to cleaning. So we don't want to excessively do the rinsing, scrubbing, or cleaning process just to prevent any potential injuries. Like there's a lot of sharp things and a lot of sharp instrumentation that you may come in contact with. Automated washer processor is the safest method. It provides a high level disinfection due to high temperatures. So
Put a star next to that safest method.
Safest method. It is the safest method just because it is where, it's like the washer, essentially. It's like the dishwasher. And once you put it in there, you don't have to put your hands on it again, and it really takes over the brunt of the washing. Ultrasonic cleaning process is safer and more effective than manual cleaning because it eliminates accidental puncture wounds. So it is we have ultrasonics in SPD. It's basically a big box filled with water and our cleaning solution. It lowers the instrumentation into the box, and then it goes through a process called cavitation into these tiny air bubbles, and they're going really fast, and then they burst, and that's basically knocking off and busting off any bioburden that is still on the instrument that we cannot take off ourselves.
So keep in mind those both say safe. So when you're looking at the test, what you want to look for is the keyword that says more effective than manual scrubbing to know that it's talking about the ultrasonic. And then I just want to break it down Barney style so you understand cavitation, because it's something that you guys have seen. Any girls in here who go get their jewelry cleaned at the stores, you ever hear that buzzing sound at the store? That's an ultrasonic cleaner, right? So what it's doing is, like she said, it vibrates at a very fast speed using heat, water, and bubbles, and basically knocks off all the debridement on there, or the bioburden. And I want to explain it, right? Bio means life, burden means bother. So all it is living organisms or bacteria that is bothering the structure of that metal or whatever that instrument is, that those bubbles are knocking off of it to make it clean.
So for anybody who wants the technical definition, cavitation process is sound waves travel through millions of bubbles during cleaning. So there are several sizes available. Always keep cleaner reservoir filled halfway to 3/4 of the way full. Solution must be changed daily, and always limit cleaning to 15 minutes to avoid damage to instruments. So after each day, after each shift, yes.
Is the washer processor disinfecting or sterilizing?
Disinfecting.
Yes, thank you.
Put a star next to each of those points right there, because each one of those questions has been asked on the test about how full it needs to be, how long it needs to be changed, and how long you need to limit the cleaning to for the ultrasonic.
Usually the ultrasonics are programmed, so we literally just hit a button and it will run through the process of decapitation, and then it will pop up afterwards. We want to take out those instrumentation to avoid any corrosion that could occur or rusting. And we change it daily after each shift, really, just to ensure that it's not grossly contaminated the water that it was just in.
I have a question.
Yes.
So is the cavitation process a type of ultrasonic?
No, in
No.
all ultrasonics, that's just the process that it
That is the
undergoes
same
when
thing?
yes.
Okay.
The ultrasonic is like the actual equipment, and then the cavitation is the process that it goes
Okay.
through within the equipment. The blank of contamination control is I know.
Sterilization.
Yes.
For what?
The blank. Do you have the answer?
I'm gonna look at it. That's a weird
Most
question
effective?
on there.
Most effective form of, no, I don't even know.
Highest level.
Highest level. Highest level of contamination control is sterilization. Blank must have a central sterilization room.
MTS and DTS.
Healthcare facility, perfect. Only the CO or
Infectious control should be involved.
perfect infection control officer can write written changes, exceptions to cleaning. Manual scrubbing, the time consuming and produce a high risk of contamination and injury, effective for cleaning instruments when machines are readily available. So manual scrubbing, the higher risk of contamination because we can be susceptible to human error. We can always miss something. Sometimes the instrumentation, it has really hard spaces and crevices to get into, so it's open to error for us, and we can always stick ourselves.
Put a star next to that higher risk of contamination and injury.
Pre-sterilization, wrapping and packaging. The most common wrapping materials are paper, plastic, nylon tubing, cloth, and never do the following. Never re-sterilize surgical drains, never re-sterilize rubber catheter bearing a disposable label, and never re-sterilize surgical disposable rubber. Obviously, we never want to re-sterilize rubber. Heat, rubber melts, breaks down the integrity. Paper plastic peel packs. After a pack has been sterilized, a heat sealed overwrapping will extend a 30-day shelf life to 180 days. I'm sorry, go ahead.
Make sure you keep that in mind because that's gonna be different than the chart you're about to see on another slide where it's talking about how long they're good for. Pay attention, it says a heat sealed overwrapping, right? It's just saying you already have a shelf life for it, but if you put this overwrapping on here, it can last from 30 days up to 180. Now we know in the real world it's event related, but per the manual, that's what it's gonna be.
Are these the ones where it's like, you have the instrument beside it, and there's like a clear plastic thing, and then the paper?
No, it says it's different. So
It's just a pack.
yeah, that's just a peel pack. So we're basically saying they have it already wrapped in whatever it is, and then they put an extra additional wrapping over it to keep it longer.
Cloth non-woven wraps are sealed with external indicator tape that changes color when exposed to sterilization elements. Internal and external chemical indicators or multi-parameter indicator ensure sterilization. The use of muslin wraps are discouraged. Sealed peel packs must be labeled with the following prior to sterilization: ID number of sterilizer, preparer's initials, dates of sterilization, and expiration. Does anybody have any idea why those things are mandatory on the labeling?
Because when you're actually wrapping like a cassette or any instrument, you always wanna make sure that the person, like everything's on there because
We're fine.
what if it is contaminated? You
There's
don't
not
have
much
the
left
date,
here.
it's in black or hasn't gone through the whole sterilization. And that just puts responsibility on the person who wrapped it or put it through the sterilizer, didn't do the proper testing beforehand. So that just shows like, not just like an infection prevention essentially.
Absolutely.
It's an easy recall system. So the minute you have it on there and something fails, you can get that load right away. I will say on this slide too, I want to hit on this point that's in red that's kind of wrong. Your chemical indicators don't tell you that this item is sterilized. It just tells you that the sterilizer has met the parameters it's supposed to. So the time, temperature, and steam or heat, right? The biological indicator is the only thing that's going to confirm sterilization within that sterilizer.
I'm surprised you don't have the lot number and the batch number for the labeling.
Sorry, say that again?
The lot number or the batch number, I'm surprised it's not listed there.
It should be. That is definitely something that you need. With that lot number and or batch number in addition to those other elements, it allows you to fact check, go back and figure out if there was a error with the individual error or if there was error with the sterilizer, the clay itself. Because if that's the case, you have to go back and recall all instrumentation, all packages that have that same lot number and ensure that it was properly sterilized. So So sterilization, this is a wrapping method and its corresponding time to related shelf life. So paper, make sure you guys take note of this, is very important. Paper envelope has a shelf life of 365 days. Non-woven blue wrap, 30 days. Non-woven blue wrap, plastic covered, heat sealed, 365 days. Peel plastic packs, heat sealed or self-sealed, 365 days.
Those are the peel packs you're talking about.
Parchment paper or Denison wrap, 30 days, and glass tubes with screw caps are indefinite.
So basically your cassettes, your big cassettes you see that are blue that come around are only 30 days. And then again, if we want it to extend to a year, then we're going to put that heat sealed covering over it.
You guys are good to go. So match time-related shelf life to the packaging material. So paper envelope. Non-woven blue wrap. Non-woven blue wrap, plastic covered, heat sealed.
365.
Peel plastic wraps, heat sealed or self-sealed.
Self-sealed.
Self-sealed. Thank you. Parchment paper or Denison wrap, and glass test tubes. Lovely. Sterile stands for free from, or the absence of all living organisms. Physical methods are sterilization, heat under pressure, dry heat, and chemical methods are gas and liquid solution. So sterilization, that's the last step. After it's been cleaned, assembled, packaged, it's gonna go through the sterilization process. Sterilization methods, there's a physical method. Steam under pressure autoclave is the most dependable and economical method of sterilization.
Put a star next to that.
Yes, that's what we use here. Downward displacement, the parameters are 245 degrees or 118 degrees Celsius. The sterilization begins when the autoclave reaches 245 degrees Fahrenheit. A pre-vac steam sterilizer, it has high temperature autoclave, most modern, economical, and requires the least amount of time to sterilize a load. Pressure is used to raise the steam to 250 degrees or 121 degrees Celsius. The Bowie-Dick test is used to determine if the air has been removed. So that is a test that we conduct daily at midnight just to ensure that the autoclave is properly reaching its correct, doing what it needs to do, and that is removing that air.
So I want you to put a double star next to the 250 or 121. I don't know if you've noticed, you've paid attention and seen that before. Guess what that is? Can anybody tell me? Where have you also seen this? Management of regulated medical waste in your kind of treatment methods. It has this exact temperature. It says 250 degrees Fahrenheit, 90 pounds of pressure, and I think it's like 15 cubic feet if I'm not mistaken. But this exact temperature here for your pre-vacuum is the same exact temperature for your sterilization method for the regulated medical waste.
We have pre-vac steam sterilizers here. Dry heat sterilization, 320 to 345 degrees Fahrenheit for 90 minutes plus a preheat. It's the least expensive form of heat sterilization, but is unsuitable for metal instruments because of the water vapors. It causes instruments to rust and dull, and the disadvantage is that it weakens fabrics, destroys rubber.
I want you to put a star next to anything that says least on here because they've all been test questions. And then put a star next to the temperature for dry heat on there. And your Bowie-Dix tested daily. It's basically saying, if air is escaping from the sterilizer, it is not able to maintain that pressure to be able to make sure that item is sterilized. So what they do every day is make sure no air is escaping that system with a Bowie-Dick test. Research day.
Sterilizing times. If the temperature is increased, the sterilization time may be decreased. The following are some practical sterilization time periods: 250 degrees Fahrenheit for 30 minutes and 273 degrees Fahrenheit for 10 minutes. All operating rooms are equipped with high-speed flash sterilizers, wrapped, covered, open instruments placed in a perforated tray are flashed, sterilized for 3 minutes at 270 degrees Fahrenheit. Sterilization timing begins when the above temperature is reached and not before. So this is an event they have a case going on, and they one of one instrument or something that they have, and they drop it on accident or it becomes compromised. So they have to sterilize it very quickly at a very high temperature at a lesser time. It doesn't have a dry time, and then once they remove it, it's still a little wet, very hot. And it's not something that we use all the time just because it can be open to any type of, it can be compromised.
A lot of facilities are going away from using it, actually. But in the Corps manual, it's used from way back when because that used to be almost standard practice because they didn't have this type of instruments.
No longer. Chemical vapor sterilization. The process uses a mixture of chemicals, including alcohol, formaldehyde, ketone, acetone, and water that are heated under pressure to form a sterilizing gas. Sterilization requires 20 to 40 minutes at 270 degrees Fahrenheit with a 20 psi. Some advantages are there's no corrosion, rusting, and dulling since water content is only 15%, and instruments are dry at the end. Disadvantages, it requires adequate ventilation due to chemical vapors.
Put a star next to adequate ventilation because that's usually what's going to be associated with chemical vapors on the test.
Makes sense. STERRAD sterilization procedure. So sterilization using plasma state hydrogen peroxide will be accomplished for those products unable to withstand steam sterilization parameters and have been approved. Reserved for items that cannot be sterilized by steam, no absorbable materials like cellulose, foam, or linen. Polypropylene materials must be used to wrap trays. So this method is used for more gentle items such as our scopes and our cameras. STERRAD sterilization operating cycle. You have the vacuum stage. It removes air molecules and lowers chamber pressure. Injection stage. It introduces the hydrogen peroxide. Diffusion stage. Hydrogen peroxide vapor penetrates the package. The plasma stage, radio frequency creates electromagnetic field converting hydrogen peroxide into low temperature gas, and the vent stage is the chamber returns to its normal atmospheric pressure.
The two I've seen on the test for these are your injection and your diffusion stages when it's talking about the introduction of hydrogen peroxide and then the hydrogen peroxide actually penetrating the package.
So the cassette, each cassette holds 10 cells, and after 10 cell cycles, a message will print out to insert new cassette. The cells are containing that hydrogen peroxide solution that we use to actually do the STERRAD process, and the screen will read when you need to give a new one. You should always wear gloves when you're touching it, just so that that hydrogen peroxide does not get onto your hands. Biological indicator test. So the biological test pack is placed on the top of an instrument. After cycle completion, it will be removed and processed with a Bacillus subtilis bar niger biological control. After 24 hours, test results will be documented and a monthly report given to the ICO.
So a thing that's not mentioned here that should be on here, I know it's in the instruction, is the placement of the biological test pack. I believe it's on. So it's over near or over the surgical drain because that's the place where least likely place that sterilization would occur. So basically, if sterilization occurs there, they can confirm it's going to happen for the entire device. And again, to make it make sense, bio means life, right? So basically, they have living spores in this little capsule. Okay, so they have a control that they go ahead and just throw in the incubator. The other one is the test where they go in and crush it, and it releases those spores. They put it in the sterilizer. When the sterilizer's done, that test should read negative that all spores within that device have been killed.
So like, if you guys remember a few slides back, the chemical indicators, that's like the tape that goes on the outside and turns colors. That's just showing you that the parameters within the sterilizer have been met. The biological actually tells you that the spores are killed and it is rendered sterile.
So, I've never done any of this stuff. So, you're taking a physical package, breaking it open, putting it on the stuff.
It's like a little pill. Looks like a little mini tube, and you put it in the sterilizer, right?
You put it in an instrument pack. So when you're the beginning of the day, right, you have called a test pack. But they put just general instruments that usually are used every day, right? And then we take a little capsule, which is the biological indicator, we crush it and then wrap it and put it inside that pack. and we put that pack in the sterilizer, and then when the sterilizer's done, we pull that pack out, pull the little capsule out, and throw it in the incubator. And we wait till that incubator says that that test is negative, and then we're able to release all the loads for the day. So we have to do that at the very beginning of the day to know that the sterilizer is actually working. Otherwise, we can't release any loads. That's where those lot numbers come into play. If somehow somebody's not paying attention and they release a bunch of loads without that test being read, now we can recall all those loads back.
And every load that you put in will have a biological in there to be tested. It's a lot.
It would help if I've like been in like a sterile, like.
Right, I know.
If I was
So
like-
trust me, I teach sterile processing, and that's the same thing. Is like I need hands-on. It's one of those jobs you have to have hands-on to really understand how it works.
Third floor.
Yes. Ethylene oxide sterilization. ETO gas, usually relatively low temperatures for sterilization. Using a heated unit, sterilization can be achieved in 3 to 12 hours at 120 degrees Fahrenheit. A lengthy aeration time of at least 16 hours must follow each cycle.
Put a star next to the 16 hours of aeration time.
Chemical sterilization. Glutaraldehyde is the only liquid chemical capable of rendering an item sterile, so long as it's submerged in the solution for 10 hours. Anything less than 10 hours is considered disinfection. So this goes back to that, when we saw those 2 separate times. It can be used for either one depending on the length of time in which it's used. So it can be used for a sterilizer if it's used for 10 hours. Anything less than that, it is not sterile, it is only disinfecting.
So put a star next to that. The 10 hours is on the test, and I know it sounds confusing. So Barney style, if it is held anything less than 10, it is a high-level disinfectant, as we hit on that other slide that we went on, right? Now, if it is past that 10-hour mark, you can use that as a sterilant, because you heard that some of these chemicals can be used as sterilants, and they're only like the one that's used for only 24 hours, whatever else. Glutaraldehyde can be used as that, as long as it's been held past 10 hours.
Like a cold sterilization?
Yep. Yep. It's like a soaking type thing, right? So it's not you sterilizing, it's just saying, hey, the sterilizer's down and we still need to find a way to sterilize our instruments. You can have glutaraldehyde and do that. It's not really used that much.
Yeah, Andy's like, no.
I know, but Corpsman Manual, way back when, it's still on test because they throw glutaraldehyde on the test all the damn time. 10 hours. Just no 10 hours. Yep. Huh?
10 hours, 1 minute is fine, yeah.
If it's like just like 10 hours and 1 minute, would that still be considered or like?
Yeah, so it literally cannot be 9 hours and 50 minutes or 58 minutes. It has to at least hit that 10-hour mark.
Sterilization methods. Critical items that require sterilization are handpieces, burrs and diamonds, endodontics, files, and Gates Glidden burrs. Further information can be found in ViewMed Instructions 6600.10.
Don't pay attention to that instruction. That's the one that combined with the 6220.9 alpha. So those two combined and made your 6220.9 Bravo, which is your healthcare associated infection control instruction.
Effective and preferred methods of sterilization are steam autoclave, dry heat oven, chemical vapors, and ethylene oxide. There are currently 3 commonly used sterilization monitors in the Navy today. The physical, looking at gauges and readings and recordings, that's the things that are on the outside of the plate that you can physically read. The chemical, internal and external, involves heat-sensitive chemicals that change colors when exposed to different conditions. Internal indicators are chemical dyes that change colors when exposed to steam, dry heat, or chemical vapor for a period of time. And external indicators are chemical dyes that change color upon short exposure to sterilizing conditions. If the indicator fails, notify the ICO and biomedical repair and secure the sterilizer can be used. Only biological monitoring can tell the HM whether or not the sterilization has actually occurred. So only that biological thing can tell you that it is truly sterile.
Just make those make sense to you because I'm going to break it down. Your internal, you have these integrators. You have class 1 to class 6. You have a class 5, basically saying it's testing for more complex parameters within your sterilizer, right? So before every procedure, the doc, the dentist, whatever else, has to see that class 5 indicator out on the tray showing that it's passed, and it's going to basically show that it's black or dark gray, and it went all the way to the line, right? The external is the tape that's on the outside of the pack, or on your peel packs, they have these little corners where you see these little pink circles. Basically, by the end of the sterilization cycle, that pink circle should be black or dark gray, and then that tape is usually white when you start, and it should be black there. So for y'all's knowledge, if you see an instrument coming back, and you're like, and it has white tape with no black marks on it, that is an indicator for you to stop and not use that and bring it back to SPS.
Biological monitors are designed to assess whether sterilization actually occurred and to confirm that all bacteria and endospores have been killed. It is recommended that at least weekly but preferred daily monitoring is done. And it is done daily. So if you can see this picture up here, that's tape, and all those black markings, that is the external indicators showing that the parameters have been met. Everything's been hot enough, bless you. And so it's good to go as far as the outside, but once we open it, we should still see that little indicator with the black strip showing that it is fully sterilized.
You know why it's daily, right? Can you imagine if I ran it weekly and all of a sudden that thing failed? You know how many tons of instruments I'd have to recall? Right, so that's why we do it daily, so we have to recall as little as possible, and we're not having to do a whole rigmarole with all that.
Positive results. When positive biological monitoring occurs, notify the ICO and record test results. Utilize another sterilizer and process the test pack with both a chemical and biological monitor and secure that sterilizer for further use. So if something is not right, we want to stop using that, test it on its own, and so we don't further contaminate or not properly sterilize any further steps after. A second positive biological test failure, you need to notify biomedical repair, make a narrative entry in the log, retest the sterilizer, confirm exposure to biological monitor to sterilization process, review the sterilization log for recent repairs and maintenance, and also secure that piece of equipment.
That's the lot number that she was talking about. So sometimes you have just a bad batch of the biological indicators where it's just going to always read positive, to where you're going to have to recall that lot number and just make sure it's maybe the product or if it's the sterilizer itself.
That is all. Is there any questions?
I know it's complicated if you've never done it before, but I promise you that for y'all, just think of washing dishes. It's the same exact way. Okay, you use the kind of chemicals in your dishwashers to knock off